With India experiencing rapid growth in the volumes of joint replacement surgery, recording, monitoring and tracking outcomes for surgeries become critically important for the safety of patients. With the population of 1.25 billion people, the demand for joint replacement surgery is set to rise significantly over coming years. According to Frost and Sullivan research, the estimates for joint replacement surgery will surpass over 150,000 every year. Orthopedic surgeons in India, in line with global trends, adopt a wide range of joint replacement implants. New implant technologies continue to be introduced with the hope that they will perform better than predecessors. However, this has not always been the case, with some newer implants having poor results or even resulting in product recalls. The impact of failures such as these could be minimized through recording and tracking implant performance through a registry. There is no mandate to keep a track of implants used in the Indian market, so India lacks real-world evidence of implant performance. To tackle this issue, in 2006, the Indian Society of Hip and Knee Surgeons (ISHKS) established a joint registry and has been collecting data on joint replacement surgeries. To expand and reach and to include all the knee and hip replacement surgeries performed in India, ISHKS has proposed to create the Indian Joint Registry to be run by an independent service provider, Northgate Public Services. Northgate Public Services is a specialist information services organization and develops, runs and maintains the National Joint Registry (NJR) in England and Wales. Using the new robust IJR platform, hospitals or surgeons will enter details of the surgery. The data entry will be quick and easy. Data will be stored in a secure data center and the information will be managed through strict protocols, which means patient and surgeon confidentiality is preserved at all times. IJR will provide a robust platform to evidence real-world performance of joint implants. The monitoring being undertaken by the IJR will reassure patients that the profession and suppliers are working to improve both patient safety and the outcomes of joint replacement surgery. The IJR will also ensure that when a problem is identified with an implant, affected patients will be identified much more quickly than they can be now. This platform will provide effective feedback tools to enable surgeons to measure survivorship, evidence clinical standards, make better informed implant selection, and compare and contrast their own clinical practice with that of their colleagues at a national level. IJR will support manufacturers and suppliers to meet their requirements for post-market surveillance. By measuring survivorship, the IJR will be able to identify failing implants early and will work with both the suppliers and regulators to ensure the swift removal of those implants from the market. IJR will form a uniquely powerful resource that can provide support to research into the full range of biological, mechanical, clinical, economic, and social factors influencing the outcome of joint replacement and establish the impact of joint replacement surgery on the well-being of patients and the population. Most importantly, the Indian Joint Registry will provide a unique resource and insight into joint replacements in India. However, for the IJR to become a world-class registry, we will require the full support and commitment of all stakeholders, especially surgeons, industry, and hospital management. For more information, please contact IJR@northgateps.com or ishks.jointregistry@yahoo.in.